Alrighty, we might kick off. So welcome everyone, and thanks so much for joining today for our postgraduate webinar series, where today, as you can see on the screen, we're going to be talking about leadership in health and human services. So my name is Ben Gillum, and I work in the Future Students team, and I'm going to be hosting today's webinar. You won't hear from me too much though, because we will go over and deep dive into a bit more around the leadership in health and human services. But before we start, I would like just to do an acknowledgement of country. Just on the next slide here, I would like to recognise the Aboriginal history and culture of the land and acknowledge and pay respects to the traditional owners and elders past, present and emerging on the land that which we all stand today, wherever that is across Australia or even overseas, and the land which all our University of Tasmania campuses stand as well. It's something that's really important to us that we always like to talk about at the University of Tasmania. So what are we going to cover today? So as you can see on the slide here, we've got a few great things we're going to deep dive into. And I'm going to hand over really shortly to Kate Fennell, who is the lecturer in Health and Human Service Leadership and also the course coordinator in leadership program. So Kate's going to be able to deep dive into this great content that we offer here at UTAS. And it'll obviously a great opportunity to listen a bit more about what we offer, but also asking some questions along the way that you might have too. So we're going to go into a little bit more around leadership in health and human service. You're going to be able to meet the team, so Kate and everyone else that looks after these programs, some of the course options, what study might look like for you, also some further study options. And then I will take over again towards the end and talk you through some of the partner scholarships we have available for these courses, a little bit about how to apply. And then, as I mentioned, we've got some opportunity for Q&A. For anyone that is new to Zoom, we do have the Q&A function down the bottom. So if you've got any questions along the way, please just pop that into the chat for either myself or Kate to be able to answer. We want to try and make this as interactive as possible. So any questions you have, let us know. But if you are listening to this recording as well, please just get in contact with us either via phone or send us an email and we'll get back to you as soon as possible. But I will hand over to Kate now to jump into the content. Thanks so much.
Oh, thank you, Ben. That's really good. And yes, a big hello to everyone wherever you are in Australia. I'm really excited to be here with you today and to talk a little bit about why study leadership in health and human services. And I guess for a lot of us, one of the things that we find in health and human services is frequently people are really great clinicians, fabulous clinicians, and we thank them by putting them into leadership positions and then wondering why they flounder. And this is a story that I hear over and over and over again. You know, leadership requires a skill set, a particular skill set, and we don't learn that in our undergraduate clinical careers. So that's one of the reasons why we started this course. And I guess from our perspective, we pride ourselves on the fact that this course is taught by sector experts. So the people that you are learning from have experience in health and human services. And so that allows you to get a really authentic learning experience. We understand where you're coming from, and we we can help you and guide you on your journey. It's also, this is a really good way of starting to build up your own professional network. Feedback I get from graduates is that this course enabled them to start building some lifelong connections in the sector and across the broader sector with other health professionals in different parts of the sector, because often what we do in one area is applicable to another, but we don't always have those connections. So this course provides you with that opportunity to start building your professional network. And as Ben alluded to, and we'll discuss later, there are some really generous scholarships through UTAS for you to undertake study in this area. Can I have the next slide, please, Ben? Okay, so this is our team. You can see there I am the course coordinator. So basically I'm responsible for ensuring that the course runs as it needs to. And I'm kind of the troubleshooter. If things are not going right, I'm the one that people get in touch with. So, but I'd like to introduce you to the team. So I'll start off with Dr. Kristen Webb, who is a practicing psychologist. So she works part-time for us, and she is a practicing psychologist, and she's a director of care in another organisation. So she comes with really great practical experience, and she's still practicing as a leader in the sector as well. Kristen specialises in teaching positive psychology in the course, but she also teaches into a number of our other units. So you would see Kristen quite a bit. Next up is Julia Wilson. Julia is actually one of our graduates. So Julia is a physiotherapist, still practicing physiotherapy as a lead physio. And as I said, she was a graduate of our program. So she really understands what students' experience is in the program, and is really practical in how she can assist you with your studies. Julia teaches into our first unit of study, which is Leadership in Health and Human Services. And that's a great introductory foundational unit that everyone gets to do. And Julia takes great care of everybody in that unit. Next up, we've got Dr. Ellen Pittman. Ellen comes to us with quite a varied background, but probably more in the business-related areas. So Ellen tends to teach into those business-related subjects, such as the management, so policy, strategy, risk management areas, that type of thing. Next up, we have Ahmed. Ahmed is a dentist by profession, and he also works in the primary health area as well. So again, someone with broad experience who has come into our program. Ahmed teaches across a range of subjects, and particularly he does the supervision unit, as well as teaching into the leadership and the risk management areas. And last but by no means least is Dr. Stephanie Kelly. Stephanie recently joined us as in this year, and Stephanie comes to us with a really broad background of leading health services, both nationally and internationally, and has a strong sociological background. So as you can see, really broad experience across the team, but everyone has that ability to understand where you're coming from as well. So thank you, Ben. Next slide, if I could, please. So what is the course about? So we call this a nested, excuse me, a nested qualification. So you can design, so it's designed so you can progress through your studies in manageable stages. Some people, jump in at the master's straight off, but generally what we find is people enroll in the graduate certificate to start with, and particularly if they haven't studied for a long time, it's a great way to get your foot in the, toe in the water, so to speak. So at the so we start with the graduate certificate, moving into the graduate diploma, and then moving into the masters. And you can see that there's different. The grad cert is about providing you with that core foundational knowledge that you need to start leading in the sector. And then as you move into the graduate diploma and the master's level, you start to be able to tailor your studies a little bit more through the use of elective units and pathway decisions. If I could have the next slide, please. So if we start with the graduate certificate, so the graduate certificate can be undertaken in a minimum of 1 year up to a maximum of 3 years. It's fully online. And we only offer part-time study, which means you can do either 1 or 2 units a semester. So if you did 1 unit a semester, it would take you 2 years to complete the grad cert. If you do 2 units per semester, you can complete it in 1 year. So what you study in this is, as I indicated, gives you that foundational knowledge. So we study leadership. What is leadership? What does it look like? What are some of the theories? How can that inform our practice? We look at management, policy, strategy, a bit of law and ethics, and how they impact on your ability to lead your services. We look at risk management and governance. And as you can see, they're really core information that you need. We also, at this level, offer 1 choice unit. So you can choose between global health systems or positive psychology, depending on what your needs are for your career aspirations. So in order to get into the graduate certificate, you need an undergraduate degree from in the health and human welfare field, or we accept people who've got any undergraduate degree in any discipline and at least 5 years relevant experience in health and human services. If I could have the next slide, please. Okay, so then once you've done those 4 units, you can go on to the graduate diploma, which is another 4 units of study. Again, so if you just do the graduate diploma, it's 8 units all up. So a minimum of 2 years up to a maximum of 5 years to complete this. As per the previous course, it's fully online and part-time. So again, once you've done all the graduate certificate content, at this level, there are 2 core units. One is around health research methods, and the other one is about leading and managing change. Plus, you can choose 2 specialised or elective units that are aligned to your interests. And we offer a huge range of elective units. So I'm confident there is something for everybody to tailor the course to your career aspirations. Same entry requirements as per the graduate certificate, so an undergraduate degree in the health or human services field, or an undergraduate degree in any discipline and 5 years relevant experience. We then go on to the masters, and again, people could choose to go into the masters. Masters can be completed in a minimum of 3 years up to a maximum of 7 years. Again, fully online and part-time. Once you've done the graduate diploma content, when you get to the master's level, you will be asked to choose a pathway. So you will either do a research pathway or a coursework pathway. So in the research pathway, you complete a major project, and anyone who's considering going on to do a PhD would look at doing the research pathway. And in the coursework pathway, you complete a capstone unit. And this is in the capstone unit, you undertake an initiative that enables you to showcase what you've learned. And a lot of these initiatives are workplace-based. So people often find they're given work time to undertake some of this unit, which is great. Same entry requirements as the previous 2 parts of the course. Okay, so each unit in the course varies slightly. But broadly, you learn through a mix of online classes is probably not quite the way to put it, but anyway, but a lot of self-directed learning, and obviously we need to assess. But what we do say is you can expect to have to study around about 10 hours per week per unit of study. So as you can imagine, if you're working full time and you've got a family, then my recommendation is to do 1 unit at a time. I particularly recommend students start with 1 unit just to see how they go. If you think you've got the capacity, then you can go on and do 2 units. So you're not locked into just doing 1 unit if that's how you start. Some people choose to do 1 unit one semester, 2 units in other semesters, depending on what's happening in their lives. So again, we try to be as flexible as possible. In all of our units, we try to run some webinars. These are run online. And generally, there'll be the webinars will be a discussion around the unit content and the assessment tasks. The frequency varies, but generally 1 per module. So we're looking at perhaps anywhere from at least 3 to 5 webinars per semester for a unit of study. Being postgraduate study, most of your study is self-directed. So we very much recognise that you are professionals, that you are adults, and that you can organise yourselves to do your study. So you'll find that within the unit content we have a curated reading list, we have interactive discussions on the discussion board, and there are other learning activities that you can do that you can complete on the online learning platform, which is called Milo. Being academic study, obviously we need to do assessments to ensure that the unit learning outcomes are being met. So in every unit, there'll be a range of assessments. Generally, there's about 3 assessments per unit, and these could be a combination of essays, presentations, might be a workplace report, could be a service improvement proposal, just depending on what the unit is. But we very much try to make them relevant to what you would be doing in the workplace as a leader as well. Thanks, Ben. I could have the next slide, and I
Yeah.
can pass it over to you.
You can. Thank you so much for that, Kate. And it's what I love about seeing all those slides is even though you're going to be an online student, you get to meet such an incredible team that's going to be looking after you, and you're going to get such a wealth of knowledge when you're going through, plus great support as well in the online space. So a lot of people can feel like it's a little bit daunting jumping online, but just know that you are in good hands and such a great team looking after you that you would have seen in the previous slides. In terms of support as well, we do have some great opportunities for anyone really looking in that postgrad health space, where we've got our health partner HEX scholarships. So essentially, for anyone that's working at an eligible healthcare provider, we offer what's called a HEX fee waiver or a fee discount. You may have heard that before. Essentially, there to support you for the cost of your study as you go through. To be able to look to see if you are eligible for this, just head to our website, which is utas.edu.au/study/partners/health. And then you'll be able to look through the enormous list of providers that we have there to find your workplace. If you can't find your workplace on that list, reach out to us and let us know. We might be able to have a look further and see and make sure your workplace provider is there or not. And you'll be able to deep dive a little bit further to see what pricing is available for the courses that you're looking at. But as a general rule, a lot of the courses available will give you a 50% discount for your study, which is an incredible way to start your studies and take away that financial stress a little bit to be able to progress further, obviously, in your career and really support that study as you come through. To be able to be eligible, obviously, is to get a Commonwealth supported place. And then once you do get your offer, you'll just need to complete a health partner employee declaration. So it's just an online form that you work through with your workplace. But at any point, if you need any support, just call through to our team or send us through an email. We're here to help you because we have a lot of people that go through this program. It's something we're quite familiar with. So just let us know if you are stuck at any point, because this is just such a great way to really enter your study and really progress yourself professionally as well. This is just a quick guide as well around how the Commonwealth supported place pricings work. So these prices here are not inclusive of the discount. So keep in mind that it will be further reduced if you do get that discount. But I always say as well, jump on our website whenever you are looking to actually study and double check the pricing, because it does change as you go through different semesters, depending on when you are looking at starting. But obviously, if you are looking at semester 2, that's brilliant. Have a look, double check your pricing. And if you get that scholarship, it's going to really support you through that program. But this is just here to help you with your future planning and see where you might want to start your study, whether that's straight into the masters or maybe starting at the grad cert level to get a bit of a taste if you haven't studied for a while as well. But as I mentioned, for that support, definitely look through our health partners and explore that a little bit further. So just going through your next steps. So I know the few people that have already joined online may have already applied for semester 2, which is brilliant. But if you haven't kicked off an application with us yet, it's quite simple. Just head to utas.edu.au/apply, and you can just start your free application with us. And it's really straightforward, just your basic details, popping in the preferences of what you'd like to study, whether that might be doing the grad cert or popping in the masters, you can do that. And then once you hear back from us in terms of your offer, we'll send you a letter, which will be your offer, and you'll be able to accept that and then go through your next steps, which will be completing your health declaration form that I mentioned around your scholarship, and then going into enrolling your units, as Kate mentioned, whether that's 1 unit or doing the 2 units for the semester as well. If you need any support on any of these steps, just call through to us. We've got a whole team ready to support you across that. Especially if you haven't studied for a while, it might be a different process to what you're used to. I know it's quite different as you go through if you haven't done that for a while, but it's quite easy once you get that support and get used to our systems. You should hopefully have a great study experience as you come through. We did just have a question just quickly pop through from Regia, who's asking about access to the recording. Yes, this is being recorded. So we'll send through the recording and a bit more information on how to apply in the coming week. So keep an eye out for your email. If you don't see it in the next week or so, just reach out and we'll be able to send that through to you as well. But if anyone has any further questions, please pop them in the chat now and we'll spend the tail end of this webinar just to go through a few questions. But I do have one that's come through, Kate, that I'm going to send your way. Can you explain some of the backgrounds of the students that might be studying this course that you've seen in the past, like maybe what sort of workplaces they might come from and what that looks like?
Absolutely, Ben. Look, we have such a broad cohort of students. So I can safely say we have students from every health profession and pretty much every state in Australia. So, you know, a really broad range of people. We also obviously have people from the human services sector. So we have people like child protection workers, youth justice workers, people working in aged care, people working in mental health, people working in the disability sector. And look, I think the thing is most of our students are working full-time or either full-time or part-time, but they're always pretty much in employment. So, and I think one of the feedback that I get from students is that they really love the diversity and it makes for really rich discussions in the units of study because people working in different parts of the sector often find A, they've got common issues, but B, they can help each other resolve some of those issues as well. So, and look, we have students who have studied, who've just recently come out of study, all the way through to, I've had students who haven't studied for 20 years and they've suddenly decided, you know what, I want to do something. So there is no barrier. If you haven't studied for 20 years, don't be alarmed. We're here to help. And, you know, we understand. So we can help you get your head around the online learning space. We can direct you. We can, you know, Julia, who I said to you, she's brilliant. She'll do screenshots of things and send them to you so you can see exactly what you need to do. So I'm very confident that you'll be able to pick it up.
Yeah, thanks, Kate. And I think that's so good to know that you will get that one-on-one support when you study this program, or just UTAS in general. It's something we really pride ourselves on what we do in that online space. So yeah, just know you've got that support, which is good. Plus building that network with all the diverse range of backgrounds that will come through in this course too. Kate, we've had a couple more questions come through here. One from Rose asking around if there's any face-to-face requirements.
No, there are no face-to-face requirements. And the reason for that is because our students are busy health and human service professionals who really don't have time for face-to-face. But we do offer the option, and it is optional, to join our webinars face-to-face. So although there is no requirement for it, we do offer it because we have found some students do like a little bit of face-to-face, but it is optional and depends on if it fits in with your work and your family and your other obligations.
Perfect, thank you. And Rose has said a nice little thank you there as well.
Oh, lovely.
I can answer part of this too, but unless you want to answer this too, we've got Regia who's just mentioned, will you recognise our previous leadership/management units completed in other universities?
Absolutely. When you apply, and Ben, you probably know more about the application process than to me, but my understanding is when you apply, you can apply for credit for previous study, and that will be assessed against the units that we have within the program. And yeah, I get a lot of applications for credit, and I'd say, I'd say 95% of them are successful. So I'm pretty confident we'd be able to recognise your previous studies.
That's great. Yeah, that's exactly the process. So yeah, you'll generally find that out closer to when you will start your program. So pop that in if you're definitely looking at semester 2 start or semester 1, and our team will assess that for you and look through. Just another question as well around the studying part in the future. What are some opportunities these courses might lead to for people that are going to complete these courses?
Okay, well, look, we've had people move into completely new areas across the health and human services. We've had people go on from, often to our students, we get a range, as I said. Sometimes we get people who have never worked in a formal leadership role, and maybe they're considering going into like a team leader role or a nurse unit manager, midwifery unit manager, those type of roles, right through to people who are CEOs and senior execs. So we have a really broad range of students, but also I've had students, and it's really interesting because students often come back at the end and tell you what they've done or what, and students often still email me, which is fabulous. But I've had people go on and just go into a completely different area of work that they never expected to, because they learnt about a different area whilst doing the course and it appealed to them, and they were able to take up opportunities in those areas.
That's
So
brilliant.
again, yeah. So and I've had people move into a CEO position, or often people go into some really senior change management positions, that type of thing, because they now have the ability and the capability of actually leading some of these processes that perhaps they didn't have before.
Yeah, great. That's great to know that can lead to so many different opportunities. Kate, that's it for us in terms of questions that have come through. Is there any
Lovely.
final words of wisdom that you'd like to pass on
Oh,
to the team that are
look,
looking to
I'd
come
just
through?
say, if you've got any further questions, as Ben said, get in touch with us. You can email them through. If Ben's team can't answer them, they can flick them through to me. I'm happy to provide any feedback to anyone, any questions that you've got. I'm happy to answer. You know, I often get emails from people. I'm more than happy to receive emails of questions. We're here to help.
Amazing. Thanks, Kate. I just want to say a big thank you for everyone else for joining today. It's been hopefully a great session for you, and you've got some good content out of that. But as mentioned throughout this whole session, please get in contact if you have any further questions. You can call us on 138827. So we're available 9 to 5, Monday to Friday, Australian Eastern Standard Time. Or you can send through an email, future.students@utas.edu.au, and that will come through to my team. And we can support you if it's around applying, enrolling, or general questions, or if it's something a little bit more detailed, as Kate mentioned, we can get in contact with her team to get that answered for you as well. But yeah, just want to say a big thank you again. Thanks so much. And if you've got any questions, please reach out. But we hope to see you studying with us in the future. Thanks so much.
Thanks. Bye.
Bye.